Misha, Ashley, anything COVID related we need to know?
Well, that's what I said. I'll hand it over to Ashley since she's here today. Me as well.
Yeah. So I don't have anything, I guess, specific to acute COVID, but there are two big things that came out in the last couple of weeks. One of them is that Canada just published their both acute COVID and long COVID clinical guidelines and recommendations. And I will put the link to that in the chat. You all can check it out. It's very easy to read, and there's also a button you can press for like layman explanation. So check that out. And also a very important multidisciplinary collaborative paper was published on long COVID. And this paper has a great chart in it for clinicians with clinical guidelines of what medications to use for different aspects of long COVID. And it is free access purposefully. So I'll put a link to that in there as well. That was a very beautifully done article. So you can check both of those out. Feel free to share them with your clinicians as well. But other than that, no other real updates, and we can take any questions that anyone may have.
If you don't feel comfortable typing your question in the chat box, please unmute yourself so you can ask the question.
Yeah, well, Randy, that's a tough one because they're very long. So basically what Canada did is they summarized every single treatment management strategy that's been discussed for both long COVID and acute COVID. And they looked at the research and then they decided whether they were going to give a conditional recommendation of yes, you should do this, or no, this doesn't have enough evidence to support it. So pretty lengthy. And there's some things in there I'll kind of say just from looking at it that there's some criticism, right? There's some medications, things like low-dose naltrexone that we know gets used all the time for long COVID that they recommended against. And we know that there's very limited research to support really anything related to long COVID or COVID for that matter, right? So it's kind of tough to summarize it. And then the paper is also a little bit more difficult, but there's a beautiful chart in there where they talk about the different medications and approaches that a clinician could take. And as a patient, this may be interesting to you if you're looking for medications. And as a clinician, this is something I think clinicians will look at to determine if this medication makes sense to give to a patient or what they could offer them for things like POTS and like conditions to long COVID. So feel free to check it out. Both are very lengthy, so do with it what you will.
No, I don't know. I would like to ask a question. This is Salome.
Of course.
I'm just curious. Is this done for the general medical people, or is it? I'm referring to the Canadian, or to the integrative medicine only.
No, it's made for general practitioners, GPs or primary care providers.
Okay,
That's who the
thank you.
target is.
Okay, thank you.
But also, they described that the target is patients too, right? So people who are experiencing disease, and that's why they added, the layman paragraphs, right, for somebody who's not a medical person. So both of those groups.
Thank you. That's great. Okay. Maybe I will read it.
Well, I don't want all of you spending all of your precious energy on reading through all these. But it does let you kind of search. And there is some information even in there about, like I said, acute COVID. So things like using antivirals, you know, that's discussed in there. I have a recommendation for that vaccine. So it's interesting to check out and see, you know, sort of what the international community is doing as well.
Ah, great. Thank you.
Okay, it doesn't look like there are any more questions. Let's move on to Ashley's.
Before we do this,
Oh,
quick
okay.
question. Anybody actually seen anybody sick with COVID in the last week? I have not.
Yeah,
Good.
just
Well,
one.
except I've had COVID.
You had COVID.
No,
Oh.
I'm over it now. I've tested negative this week, but I got it on the 14th.
How did it go?
I'm sorry.
How did it go? Were you really sick, or it was mild?
It was like I haven't been sick for years, so it was like a head cold that I remember from my childhood.
Mhm.
So my nose was stuffed up and I was coughing. The first couple days I would dry swallow in my throat and inner ears would hurt, and then it turned to coughing and sniffles. And I was lucky to reach somebody who gave me a prescription for Paxlovid. People have been warning me about rebound COVID now, and I'm not sure what to make of those warnings. But
how soon after symptoms started you took Paxlovid?
I'm sorry.
How soon after your symptoms started did you take Paxlovid?
Oh, my symptoms probably started on a Saturday night, and I started COVID on a Wednesday morning. So it was within the 5-day period.
Yeah, but it really doesn't work within 5 days. It really needs to be taken within first 2 or 3 days. So chances are Paxlovid did nothing. Current evidence is very clear. For mild symptoms, it does zip. It does absolutely nothing. So nobody should be taking it. So it's a good example. I mean, you know, because if you would have gotten it serious, you would have gotten it serious by day 5. So usually idea here goes simple, that if your symptoms are mild, they will stay mild. They're not going to continue escalating. So which is a great example. So you went through a very typical scenario. Most patients gonna be like this nowadays. So that's
where they're sleeping they're sleeping around the clock and then some. I mean, basically,
yeah,
I slept.
People right. So some people will sleep more. Some people will feel quite fatigued, but you know, not to the point that they can't do anything. Like, you know, so definitely the sort of a more of an acute scenario where people will end up with severe shortness of breath, very high fevers, those kind of. We're not really seeing this anymore, which is great. One thing now, your conversation about vaccines is irrelevant because I wouldn't even bother thinking of vaccinating at least for 6 months after the infection. So you can sort of definitely wait till fall and we can see what's going to happen. It's very possible they're going to just remove all the vaccines, period. They may simply not push people to get any more vaccinations as a requirement. They'll probably not also going to push makers they're not going to pay them. So
okay. For the record, I was due for a COVID vaccine. My second COVID booster, senior booster, on March 10th, which I skipped. And
yeah, I don't think that, you know, I don't think that has anything to do with that.
So I probably would have gotten COVID anyway, in other words.
Yeah, probably. You know, you would have gotten it anyway. The question is, would have been it slightly less serious? But I mean, it sounds like it was mild as is. So
I think so. I mean, I don't know what to compare it with, but
right.
I could function. Yeah.
Right.
Thank you.
Now the key question is, are you going to completely recover within the next week or two, or will you have some lingering long COVID symptoms? So I'm sure that's what Ashley is going to talk about next. Is it?
Well, I'm going to talk about MPAS.
Okay, well, that's good. That actually kind of fits with this whole conversation because MCAS is one of those common symptoms that unfortunately flags your patients particularly. So So
Good
Cecile,
job.
thanks so much. And
Oh,
let's
thank you.
sure, let's switch to
And I also put the CDC website for wastewater data, which in my opinion is the most accurate data that we have right now because so many people aren't testing anymore. Wastewater data is pretty good data. So you can look at the national trends on that website for RSV, COVID, MPOX. So something to look at. It looks like in DC, COVID is actually higher than our neighbors, Maryland and Virginia. So that's interesting. Probably because it's a city, right? So check those out if you're looking for numbers of how high things are going on right now and trying to decide if you want to be vaccinated or how you want to approach that. All right. So Janet,
I have a question.
of course.
I'm trying to fix you can't see me, but I don't know what's wrong with my camera.
Oh, that's okay.
Is GW going to be able to depend on CDC for recommendations about vaccines, et cetera, with what's going on with the new?
Well, I don't believe in CDC recommendations. I have not been following them in years, and I
All right, that's the answer.
I refuse to follow them because they're bullshit.
Good.
Now, what will happen under this administration with this? Your guess is just as good as mine. We're just in a kind of a very suspended territory. Who knows what will happen? We have to just wait and see. But GW will probably, since you ask about GW, most likely GW as an enterprise will probably follow best evidence. They have been following CDC recommendations in the past.
Right.
They will follow. Providers don't have to comply with GW recommendations. GW has always been relatively democratic about it. They never really told the providers, you must do what we tell you to do. So no one, for example, ever came after me saying why you stop telling people to give boosters frequently, So I think there's a lot of recognition that relationship with patients depends on not just CDC recommendations, but on this
Well, good.
Patients.
That's good. Thank you.
Mm-hmm.
Yeah, and just as a side note, the CDC's Advisory Committee on Immunizations just met April 15th. Okay. So I know in the news there was a lot of controversy over their meeting got delayed, they're not going to meet, and they did meet the 15th and 16th.
Well, it's the fear is there are not going to be any vaccinations.
Well, of course, yeah, because if they can't meet, then they can't decide, right? About the vaccines for the new year. So it was a good, it made sense that people were worried, but I'm just reassuring that they did meet. And there likely will be some recommendations, whether they're taken or not, there will be some recommendations, I'm sure, by fall.
So basically you follow your physician.
Me personally?
No, everybody.
Oh, yes, of course. Yeah, you have to go by what your provider and clinician, thinks is right for you. And also your experience too, right?
Yes.
Because you know your body more than anyone else.
Yes, thank you.
Of course. All right. Any lasting questions? Then we can get started. All right, well, let's get started. So I'm going to share, I have some slides and I'll share them. Because if you're like me, I'm a visual person. Let's see here. Everybody can see the slides. They're in the right mode, the PowerPoint mode, and everything looks okay. I'm going to take that as a yes. Okay, so I chose today to talk about mast cell activation syndrome, or MCAS, for a few different reasons. So one, it's something that we see in long COVID all the time, right? There's a lot of overlap, but we also see it in a lot of other illnesses, things like SIRS or chronic inflammatory response syndrome. And then there are people who have mast cell activation syndrome and they don't have long COVID or SIRS. So it's an interesting disease. It was first reported in 2007 with a prevalence of around 17%, right? So just because it was first reported in 2007, obviously does not mean that it didn't exist before then. That's just when it was first reported. And likely now, after the COVID pandemic, we're looking at a prevalence that's probably much higher than 17%, right? And it often goes undiagnosed because it's something that your clinician may not be thinking about. And it's something that can be difficult to diagnose via objective measures like labs, although I will tell you some labs that you could have checked. And really what it is that there's this dysfunction in the behavior of our mast cells. And think of our mast cells as kind of I like to think of them as the bomber planes of the immune system, right? Anybody who knows me knows I spent 6 years in the military, so some analogies in my head are kind of military oriented. But they're sort of the bomber planes of the immune system. They're not specific. So when mast cells get activated, right, then they secrete a ton of different substances. So they secrete histamine, which is the part we all kind of know about, right, when we think about mast cells. But they also secrete heparin, tryptase, chemokines, prostaglandins. Prostaglandins are what we know to cause pain, right? Prostaglandins have a part to play in pain. Heparin thins blood. So some of these are outside of what we typically think about when we think about allergies. And in some people, these become dysfunctional, and so they activate and degranulate, they break down and they release these substances at inappropriate times when they shouldn't be, right? And with COVID, the reason why this happens is because we have a ton of inflammatory proteins called cytokines that are released when we get acute COVID, and then it leads to this overall immune dysfunction. And this has been proven in many, many different studies, but one in particular looked at lung biopsies of COVID patients, and there was a very large number of mast cells with those tissue biopsies. So why do we care? You know, what does mast cell disease do? What does it look like? Well, you can see on this picture, it pretty much affects every system in the body, right? Because again, it's that bomber plane that's really nonspecific. So you can see that it affects the brain, the skin. The skin's what we think about when we think about histamine, right? Like itching, hives, that all probably like comes back as something you remember. But probably something that maybe you didn't think about was bladder irritability, or urinating all the time, or rapid heart rate, or chest pain, right? Or brain fog, headaches. Headaches are a huge factor when it comes to mast cell disease. So if you're somebody who's been a migraine sufferer, or somebody who's even not migraines, who's just been suffering with headaches for a long period of time, think about mast cell disease. You know, it might be one of the kind of rocks that's laid uncovered, right? Lots of GI issues. So things like diarrhea, nausea, vomiting, acid reflux, these all can have a mast cell mechanism underneath it. So then you may be asking yourself, Ashley, this is a lot of the same things people have with long COVID. So how do you tell the difference, right? And you wouldn't be wrong. So I'm just going to skip forward for a second, but that's exactly what this study did. So it looked at long COVID in people who have mast cell disease without long COVID. And you can see it looks pretty similar. So if you see over here on this right side, just do the little arrow here. Hopefully you can see my arrow. But if you look over here, you can see that it pretty much matches up, right? These two graphs, whether it's mast cell patients before they get treated or it's post-COVID patients, it looks really similar. So that's why we're seeing, and it's probably similar because it's the same, right? That's why we're seeing so much mast cell disease after COVID. And then pre-COVID populations and just general population controls also look about the same. So not everybody has this experience. Okay. So how do we know we have this? So even if you're thinking here saying, oh, do I have mast cell disease? How would I even know I have mast cell disease? Well, there's some labs that you can do. So I'm going to skip over to this. So from a diagnostic perspective, these labs are all labs you can get at a regular sort of LabCorp or Quest. These aren't special functional labs, right? So these are things you could ask your clinician to order for you. So you can have them order a histamine, you can have them order a tryptase, a chromogranin, 24-hour N-methylhistamine. So these are all things that are pretty easy to get. Issue with all of these labs, right? The one sort of problem with this is that a lot of these biomarkers don't stay in the body very long. So they usually stay in the body for about 20 to 30 minutes. And because of that, unfortunately, you can get a false negative, right? So you could have mast cell disease, but it's showing up as you don't have mast cell disease based on the labs that you have. So as somebody who treats a lot of people with long COVID and sees this a lot, I often will order it on everybody because if it is positive, and I have found quite a bit of positivity, then it's something I can kind of monitor as I go along. So it's not completely irrelevant. It's still used in practice. And one of the most definitive ways is if you get biopsy staining. So you would get this in an upper or lower endoscopy, and that GI can or pathologist can stain for these mast cells. And that is the most definitive way to get a diagnosis. Sometimes you have to go to a special gastroenterologist, somebody like a neurogastroenterologist, to do a test like this. Okay, and then I'm going to go back. We're going to jump around a little bit. So another study that was published in 2023 also looked at patients with long COVID. And they gave that patient group both Allegra and Pepcid. And they did this because Allegra is an H1 blocker, right? It's a type of histamine. And Pepcid also blocks a type of histamine called H2. So they gave them this medication and they found that about 29% of those patients fully resolved that were in that treatment group. And there was no difference in the control group. So what's interesting about MPAS is that some of this you can do on your own. So if you're sitting here and you're thinking, well, maybe this is me, but I don't know if I have somebody who will order these tests. This is a trial you could do by yourself. So you could say, okay, I'm going to, take these medications and see if this helps any of my symptoms. And if it does, great. Maybe there's a mast cell component. And if it doesn't, maybe there likely isn't a mast cell component. And that's what I do with a lot of my patients when I suspect there's false negative results, then I'll probably have them do an antihistamine trial. You can also do this with a product called Natural Dehist, which has a lot of mast cell stabilizers. It's a more natural product. So if you want to go that route, or you have some intolerances to antihistamines, you could try doing it with that medication and seeing if it works. So let's go to treatment. So there's a lot of different factors of treatment. If you want to go the medication route, which a lot of my patients have to because they're pretty debilitated and sick, they may do an H1 and H2 blocker, right? We talked about those antihistamines, but also some of them will use a more natural product like Natural Dehist, which is going to have quercetin in it, vitamin C, NAC, stinging nettle, a lot of mast cell stabilizers all in one product, which is why I tend to veer towards that product as a good one, because it has many of these things all in one place. Or you could try taking some quercetin or vitamin C or NAC without using that product on your own and seeing if that helps. Those are all mast cell stabilizers. This is also a good rule of thumb if you're just the person in here who has seasonal allergies, right? So say you're somebody who's just really suffers during this time of year, you could add some of these supplements into your lifestyle and see if they help. And you might find that they do. DAO enzyme is an enzyme that breaks down histamine. So you can take this before meals that are high in histamine. And that's another aspect of this disease. So many people who are really struggling with MCAS will end up on a lower histamine diet. So this slide here kind of tells you which foods tend to be higher in histamine. Unfortunately, these are the foods that we probably all know and love, right? So your charcuterie board, your aged cheeses, aged meats, beer, wine, right? Tomatoes, chocolate, of course. So, whenever there's a dietary component of anything, it's all the things that all of us would like to eat, unfortunately. But you may notice on your own that, I do have, some sensitivity to some of the foods that are higher in histamine. Maybe it's not because of, maybe it is because that they're higher in histamine that I'm having that reaction. Maybe I already have a large burden of mast cell activation, and adding these other foods in tend to aggravate. I find too that some of my patients who have been diagnosed as having just acid reflux, right, and given their, the run-of-the-mill Prilosec, often a large part of that is histamine intolerance or MCAS, inappropriate histamine activation. And so getting rid of these foods can be helpful. And then if we go back to here, the other things is figuring out some of the underlying mechanisms, right? Because if there is chronic inflammatory response syndrome, and there's some sort of mold or other environmental or biotoxin that's causing the problem, you know, binding that and getting rid of that from the body can also be the answer to treat the mast cell activation too, or modulating the immune system. I also find interesting is that there's some mediators of mast cells that we don't know are mediators of mast cell or don't think about, right? So things like benzodiazepines, you know, your Ativan, your Xanax, those are all mast cell mediators. Low dose naltrexone is, not NSAIDs like Celebrex, you know, medications that are used all the time are. Corticosteroids are mast cell mediators. Singulair is often used as well. Sometimes we use mast cell stabilizers like cromolyn. And then, of course, healing the gut, right? Because the gut, you know, the gut's that hub of the body. So you can't ignore it. It has a huge part to play. And there are some probiotic strains that decrease the histamine burden. And then anything that's going to work on your limbic system, right? Your nervous system may help as well, because there is this difficult association and cycle between the nervous system and mast cells. So mast cells can get secreted when there's sympathetic tone, right? When you're in that fight or flight response. So it's, you know, managing both of these things kind of simultaneously, which can be helpful. All right, so I'm going to stop sharing. And I want to hear from all of you any questions that you might have, or if you've had any experience with this. Right. If not, we can probably go to the mindfulness practice.
All right. Well, we got a lot of time today. I think we're going to finish a little bit earlier. So, and then what we'll do is last 10 minutes or so, we're going to stop recording and I'll stay here to, if anybody wants to cover anything personally. So we're going to do it a little bit different. What I'm going to do is I'm going to take my laptop, since I'm in a cabin, so I have a luxury, but I recommend for you guys, if you have access to a window or, you know, you have a plant in a house where you can't actually sit outside, what I strongly recommend for you is to grab this moment and engage with the nature around you just a little bit. I'm going to just bring laptop just outside of the cabin and sit in front. So I'm facing a forest. If you don't have a capacity for that and you're inside the house or you're, let me pin myself here to the screen. You can hear me okay? Sound is fine?
Yeah.
All right. It may actually rain. If it starts raining, I'll have to move back in, but I'm gonna hopefully just not needing to do that. So find yourself getting closer to the nature. Again, as I mentioned, it could be a plant. It could be, it is raining, so I'll have to go back inside, I think. Well, let's give it a second. Maybe it won't rain. I want us to connect to the elements. That's what I want us to do. We're going to do a practice of elements today, but we're going to do it a little bit different. We're going to do it trying to really tune into each element as it is, rather than imagining things or rather trying to, you know, form some concepts in our mind. Yeah, I'm going to side, unfortunately. Bummer. I was hoping to stay here. But oh, I can just, you know what? I'll just do it this way. I'll just move myself under the roof this way. Yeah. All right. Yeah, that's perfect. All right. Oh, this way you can also see a little bit of a greenery behind me. So if you don't have access to it yourself, feel free to just look at my screen. In fact, let me just turn it even more. Do it this way. So we're all gonna see even more greenery behind me. And I don't know if you can hear the chime. So that's great, because if you can, it brings the wind, it brings the sound of air itself. So get yourself comfortable. If you're gonna look at my screen, that's fine. If you're gonna step outside on your porch or through your window, that's great. Begin to attune yourself to that state of being present in the nature. I think being present in the nature, in the elements, is one of the most simple ways for us to connect to elements and to become aware of our part in it. There's a little bit of a wind going on, and it's slightly raining, very little, just there's a few drops here and there. But it feels like as if it will rain. So the sense of the nature right now is kind of anticipating the rain. Start shifting awareness to your breath. We'll begin with the earth element, sensing our attachment to the earth through the feet, connecting to the ground. See if you can feel the heaviness of the earth. See if you can sense how your feet are touching the ground, or if you're on your deck or at the room, first touching the floor. You can keep your eyes open or closed, whatever you prefer at this point. Just make sure you just continuously have capacity to open your eyes and absorb the sense of nature. There are all kinds of noises around me right now. Some wasps are flying, the chime, the wind, kind of an orchestra of life. But all of that originates from the earth. And we keep on breathing through our nose, inhale and exhale through the nose. Shift to the water. Inhale through the nose and exhale through the mouth. Connect to the water element. You can connect to the you know the body of water close to you, or you can even connect to the sense of coming rain that is right in the air right now where I am. It's a wonderful feeling, actually, to know that the water that's so needed by plants in our area is always welcome, and we're blessed by having a lot of it, in contrast to some parts of the world where water is scarce. So let's tune into the flow of water in our own bodies, the flow of blood, the flow of lymph. Let's move to the fire, inhaling through the mouth and exhale through the nose. Sensing the sun, even though it's behind the clouds right now, but it's there. Feeling the warmth, but also the magnificent power that comes with the sun, with the fire, cleansing our emotions from anything unneeded. We're in a always challenging times where our emotions, our hearts are challenged by the current things of involving around us. So this is the time for us to let go of all those thoughts that are triggering us, that are causing frustrations. Inhaling the cleansing power of fire and then exhaling, letting it all dissipate. Allow the fire to rise, to elevate your heart, to feed it positive emotions. Allow it to realize that no matter how difficult things may seem around us, there's always peace, love, compassion, things that defined who we are, things that keep us human. If you get tired, you want to lay down, by all means. If you want to close your eyes and even consider taking a nap, that's all perfectly fine. But gonna do that, just follow my voice. Do a few more 5 breaths here. Let's move to the air. Inhale and exhale through the mouth. Very subtle breath. You can imagine taking in the air coming to us through the wind and from the forest, from the trees. Let that clean air purify our thoughts, purify our minds. The chime that, I don't know if you hear it or not, but we have this beautiful chime right here that makes this gentle, constant sound because the wind is steady blowing. It's the same way our minds are following the winds all around us. Not physical winds, but the winds of our consciousness. We love to follow them. We love to let them come and dictate their pace. Do that, follow them, listen to the wind, listen to the chime, but realize that we're not our thoughts. We don't have to actually attach any of our feelings to them. We can also control them in a way of holding on to the thoughts we want and let go of others, not continuing attaching any energy to them, releasing our thoughts that are not serving us well, telling them that they don't control us, we don't need them. It's good enough to just grab on to the thoughts we want to only. Make sure your breath is not shallow, even though it's gentle, but it's still deep and slow. I'm noticing that I'm getting so relaxed that I'm getting really sleepy, which is really good actually. Also means that probably have not had enough rest in the last few days. I hope to catch up on the weekend. Gradually begin to let go of the mind world. In 2 more breaths, we'll transition to the ether. Shifting our attention to that which we call divine. And by all means, you can just be aware of greater. I'm in the nature elements in the forest, so I'm going to connect to the spring nature all around me. as the way of being part of a greater, being aware that I can always default my awareness to this, become part of the nature, become much less engaged in my own limited self by being part of something much larger than me. So with each breath, and you can inhale and exhale through the nose or nose and mouth together. So with each breath, deepening this engagement with larger. And if for you it's God, that's perfectly fine. Whatever word you want to use is the right word for you. Each breath, purifying the link between us and the greater. Each breath serving as a bridge, realizing that with each breath we can bring in divinity that's all around us into ourselves, and then exhale and return to the greater. This never-ending cycle of give and take, the divine give and take. I'm gonna say a healing prayer now, yes, and you don't have to know it. If you do, that's fine. You can follow me. Beloved Lord, Almighty God, through the rays of the sun, through the waves of the air, through the all-pervading life in space, purify and revivify us. And we pray, heal our bodies, hearts, and minds. Amen. Thank you, everybody. We'll see you all next week. I'm going to stay here, as I said, for about 15 minutes. So that give those of you who need my personal attention time. Otherwise, Janet, who do we have next week?
Maybe she
Let's see.
stepped away.
Yeah, I don't know if the recording's still going. I'm gonna stop the recording.
Well, I'm going to take off, but it was so good to be with all of you today. Thank you for your listening.